Welcome back to Dateline New Haven on WNHH-FM, New Haven's home for community radio. I'm Paul Bass, inviting you to look behind the headlines and the stories that make New Haven tick. Some of those headlines of what really has made New Haven tick has been the Fairhaven Community Health Care, formerly known as the Fairhaven Clinic, Fairhaven Health Center, and the woman behind it, Suzanne Lagarde, who's playing a key role in keeping people alive and healthy during the COVID pandemic. Suzanne, welcome back to Dateline New Haven. Thanks for coming on today.
Glad to be here, Paul. Can you hear me okay?
I can hear you fine. And did I get the name right? Because every time we write about you, which is often, I always have to look up what we're calling it these days. Fairhaven Community Healthcare, is that the name?
You got it. You got it. Spot on.
Now, for those of us who are a million years old, we have a hard time not calling it the Fairhaven Clinic because and tell me if I'm wrong about this, along with the Hill Health Center, the Fairhaven Clinic was one of two community-based grassroots healthcare organizations that sprung up during the Great Society, 1960s and 1970s, and have grown and evolved to this day to become major providers of healthcare in our community, surviving all the fights over healthcare in our country, getting supports from Democratic and Republican congressmen and presidents, really becoming mainstays of how we stay healthy. And they branched out to being much more than a clinic for people to walk into. Is that a right way to put it, Suzanne?
You got it. In fact, this is our 50th year anniversary. So
okay. And with only two people running it, right? Katrina Clark starting it, right? And then
yeah. Katrina Clark was the first, and I'm number two.
And how many years you been there, Suzanne?
This is going into my 9th year.
That's one thing that always fascinates me as an observer of community, how organizations pass the baton. So many organizations get founded by someone with vision, get people excited, and then they have to make that second step where people in the community serve on a board, a staff is in place, people in the public deal with it, and help it get past the person whose image it was created in. How did you do that? Because you're here for 9 years. Like often, let's say houses of worship, churches, synagogues. Sometimes people are up there after 50 years in New Haven. The next person's dead meat. Right. As soon as the last person leaves, half the people say it should be done the way they did it. No, we have to change. They kill each other. And the transitional person is sacrificial. How did you get established to still be there 9 years and running and take it to a new era?
So you strike an interesting note because when I took the job, which was in June of 2013, I was still working at Yale towards my MBA. And I learned in my MBA course that 50% of CEOs who follow founders are not in the job within 2 years.
That's what I was saying.
I found that statistic rather daunting at the time, but it didn't deter me. So here I am 9 years later, but there's no question that there's a challenge. A culture is built, and one of the culture that I inherited at Fairhaven was one that was incredibly community focused, incredibly staff focused, but at the same time was also in big financial difficulty because there was not more of a business corporate kind of mentality. And the challenge was to meld those two. I often said that my challenge was to bring a little more business and a little more corporate think into Fairhaven, but without losing its heart. We had to keep that heart. That was really critical. And
how did you keep that heart going?
You hope that you succeed. Here we are 9 years later.
Well, you did succeed. We're going to talk a little bit some of the ways you succeeded. In addition to keeping a mission going and bringing it to a new era, anytime an organization like Fairhaven gets established, the world changes around it, right? So while Katrina Clark still ran it, it branched out to schools. There was this need, right, to have clinics in schools, high schools, right? They went there. And I believe you've continued to expand. Aren't you in East Haven now? You're not just on Grand Avenue.
Oh, no, that is true. So we're not on Grand Avenue. The biggest, when I came here, we spread out on Grand Avenue. So we have a second site on Grand Avenue right along the Q River. But we also opened a site. It's in Branford, just beyond the East Haven border.
Okay.
And then a year ago, last fall, we opened a large site down on Long Wharf in collaboration, as you know, with the Yale New Haven Hospital.
Well, that's a different issue I was going to bring up to you. So you guys used to be the community health centers used to be, well, they are in low-income neighborhoods, people who aren't served well by major institutions. So, Hill community, it was Black and Latino people who might not have always gotten primary care they would need it in the community. In Fairhaven, obviously, when the immigration exploded in town, you reached that community. But now something very different has happened, which is that Yale New Haven Hospital turned to you guys. They're the big healthcare provider. They turned to Hill Health and Fairhaven Health to run all primary care for the entire hospital system. So you opened up this primary care center in Long Wharf, which I think is a little ironic because it didn't used to be CHCP, the first kind of HMO we had back in the 80s.
My first job after fellowship was at CHCP.
Okay, and that's when that was seen as an answer for making doctors more connected to the community and running better. And then it turned into a monster in many ways, into the new corporate healthcare bureaucracies that were distant from people. So now we're trying again. All of the hospital's primary care for the region, right, takes place on Sergeant Drive near Long Wharf Theater at the primary care center that is run by you and Hill Health Center. If I'm not mistaken, it's been 2 years, correct?
Last October was a year. Yeah, October 26, 2020, we opened.
So how's that going? Now, how have you
It's
evolved?
going extremely well. It had been many years in the planning, 5 years in the planning. We anticipated there would be hiccups. We didn't anticipate opening in the middle of a pandemic, which we did. But it's going extremely well. Fairhaven runs the pediatric clinic. Colonel Scott runs the adult clinic. But we're all one. I mean, although it is, it clearly has a different feel. I mean, all of our sites have different feels. This is all part of Fairhaven Community Healthcare. Whether you're on 150 Sergeant Drive, 374 Grand, or Main Street in Branford, it's all part of one.
How has that changed, if any way, what you do back at the source on Grand Avenue? Are you seeing the same people for the same reasons that you did before?
Yeah, I mean, clearly we took on literally overnight, something like the care of 12,000 kids. So our practice organizationally is certainly more slanted in the 18 and under group, although we still easily 40–50% of our population remains adult above that age group. I think it actually opened up opportunities, right, for more collaboration. One of the things I've learned in this job is you can't go it alone. And collaboration is critical. And so whether that collaboration is with the big players in town, right, Yale New Haven Hospital, or whether it's here in Fairhaven with ULA and Junta and Semilla Collective, they're all critically important pieces of what we do every day to serve.
So even if they fight with each other, they can get together and work with you.
It's critical. I mean, right now in the midst of COVID, the collaborations are crucial.
Well, that's where I want to go next. We're talking with Suzanne Lagarde of Fairhaven Community Healthcare on WNHH's Dateline New Haven. Suzanne runs it. Is your job president or CEO or both?
CEO.
CEO. And so you mentioned the C word, COVID. When COVID hit New Haven, what could be more important in Fairhaven than the Fairhaven Community Healthcare, where so many people who have the hardest time accessing healthcare and were disproportionately hit by the pandemic, people of color, lower income people, immigrants, that's where they got the help. So the first thing that I saw you guys going on in a big way to fill a big gap was vaccines. And again, you just talked, Suzanne, about community, working with community to make something happen. So I'm thinking, was it last summer when you had the big campaign to get Fairhaven vaccines?
It was in March.
Rates were low, right?
It was in March. So, if you recall, vaccines came on the scene very end of December, early January. There was originally, this system set up by the CDC and espoused by the state called VAMS, Vaccine Administration Something or Other Service, which is how you got your appointments to get a vaccine. And when demand outstripped supply, there was a frenzy. Everybody was looking for a place. And we, like everybody else, signed up on this portal, and our open slots got filled within literally seconds, but we realized that it wasn't getting to our community, right? We were seeing people from Fairfield County, from the shoreline, from everywhere in the state. But this system, which was not in Spanish initially, it was just in English, required access to a computer, required an email address. Something as basic as an email address was a barrier to some of our patients, was really out of reach. So it took us a few weeks, but we pivoted away from VAMS and then started again with this collaboration with our community, a program called Vaccinate Fairhaven. And truly, I cannot take credit for that beyond saying that, you know, we reached out to our community partners, and it was the community that rapidly assimilated over 300 volunteers, modeled the program on Get Out the Vote, and literally broke up the district of Fairhaven into sizable pieces where volunteers were assigned a little quadrant. And the job was to knock on every single door in Fairhaven. And that was accomplished over a 6-week period. And when we knocked on those doors, they were offered appointments, they were offered transportation, and it worked. And the other way this worked is we were able to vaccinate over at Wilbur Cross because Wilbur Cross wasn't open. So we had access to one of their gyms, and through a collaboration with our partners, again, ULA, Junta, Iris, Haven Free Clinics, Samia, the list goes on. We gave those partners the opportunity to book onto our schedule. We wanted, you know, here are 200 slots, you book them and we'll vaccinate them. And that program worked extremely well in collaboration with Vaccinate Fairhaven. We were vaccinating upwards of at our peak, we hit over 600 vaccines in one day.
And how did the percentages work out? Was Fairhaven lower than state average? What did it end up?
I mean, well, if you look at our race and ethnicity data, it was like 70% white. Today, I can tell you that if you look at all of our vaccine data collectively from the very, very beginning, we have vaccinated of the over 30,000 doses of vaccine we've administered to date, over 60% are racial minority. So,
you know, what was interesting to me when I heard you describe that? You made a point of not just naming the community groups you worked with, but of crediting them with take the lead. So sometimes when you're the most established healthcare organization with the expertise and the links, you have to take the lead, right? And sometimes if somebody else is taking the lead, you have to know when to let somebody else lead and be part of a group, because there's so much turf in the nonprofit world and the helping society world. Am I right that I was hearing that from you, that in some cases you had to take a lead, and in other cases like Vaccinate Fairhaven, you had to be a part of the group that was being led by people in the community, but doing something they couldn't do, which was to give the shots?
Absolutely. I mean, I was realizing that people 2 blocks from where I sit today were not coming in to get vaccinated. And I'm like, how do I get to these people? They're 2 blocks away. I have people coming from Fairfield County, yet I have somebody 2 blocks away who's not coming into my door. So I reached out to leaders. I mean, one of the things I've learned about Fairhaven in my 9 years here is there's an incredibly strong network of residents. The district management team, which I'm sure you're familiar with that model, is a very active in the community. We're an active member as well. And I reached out to these folks, and they ran with it. They, you know, people like Kika Matos and Karen Du Bois Walton and, you know, Sarah Miller, and who's now an older. They basically said, we can do this. We can mobilize this community. And literally, it was the community who canvassed the community. You know, we provided the medical expertise, we provided the vaccine, but I absolutely cannot take credit for that incredible effort. And I can tell you that we're revisiting, we have just recently sort of revitalized some of that group, because last week we managed to get about 2,700 test kits for COVID. And we were drowning in.
Let me stop you there, because that's where I want to go next. Let me remind people to, no, apologize. I appreciate it. You're into it. You're listening to Suzanne Lagarde. She, for the 9th year now, is doing a great job running the Fairhaven Community Healthcare. Those of us used to know it as the Fairhaven Clinic, the main provider of healthcare in Fairhaven and now citywide for young people. You just talked about, and you listen to Dateline New Haven and WNHH-FM. 103.5 and live streamed on newhavenindependent.org. Suzanne just told us that great story about earlier in 2021, when vaccination was not seeping to the grassroots right around her neighborhood, and that she turned to the leaders of her neighbors at the grassroots who did this wildly successful campaign to knock on every door and get people their shots. Now, as we go into 2022, one of the big hurdles with COVID is testing. It's crazy in America. 3 years, into our third year now of a pandemic, people can't get tested to find out if they even have COVID. We have a surge with Omicron. Over 25% of people tested with PCR tests in the state are positive. We're trying to keep schools open. We're trying to keep people at work, trying to keep families safe, but we have to find out if they have the virus. So you were about to tell us, Suzanne, before I interrupted you, about how you've pivoted with that grassroots approach to get people testing for COVID.
So we've been testing since last August when Delta started to act up. We were testing prior to that very actively through June 30th. That contract with the state ended. As you recall, the summer was pretty quiet, but then by the end of August, things were acting up again. So it was clear we needed to start testing. But now we didn't have a contract with the state, so it was sort of on our own, but that was okay. We were testing. The demand wasn't excessive. In the past few weeks, no secret, the demand has just accelerated beyond belief. And this whole issue of trying to get rapid at-home tests has also, become an issue because we're not able to meet the demand. We see here 250, 300 people in a 4 to 5 hour period that's what our resources can support, and we turn away hundreds. That's what's been happening in the past few weeks. I'm going to give you an incredible statistic, Paul. We tested last week, the week of New Year's, so it was a 4-day week, Monday through Thursday. Friday was the holiday. We tested each of those days around, in total, we tested 1,022 people last week. And we had to turn people away because we just didn't have the staff. Our positivity rate for last week was 44.7%.
Wow.
I'm going to say that again, 44.7%.
And that's what people came to the center on Grand?
Those are people who came up to our clinic to get tested, and we had to turn people away.
At Grand Avenue.
We have been struggling for weeks. We've been reaching out and not getting much help from the state, to be very honest with you. And we'd been also working, I've been working literally since October because the federal, our federal agency, a program called HRSA, HRSA, had been saying they were going to stand up a rapid at-home testing program. And it kept getting delayed and delayed. Bottom line is, I kept pushing, and they kept saying they were going to send us something, but then they weren't going to send us something. And miraculously, Thursday afternoon at 2:00, we got 2,700 rapid at-home tests. Again, this is Thursday at 2:00 before a 3-day weekend of a holiday weekend. Because of this collaboration and this networking between Thursday and Friday, we were able to get those tests out into the hands of people who needed them the most.
In 24 hours?
Oh, less. I mean, we started Thursday. So let me backtrack. Earlier in the week, I was hoping I was going to get these test kits. I had no guarantees, but we reconvened the group last Wednesday of the same group that had met during the days of the vaccine. So again, representatives from Samia Collective, Iris, ULA, Junta, Haven Free Clinic, New Haven Legal Aid. And we talked about these things are coming. When they come, this is what we got to do, right? We got to have a list. We got to have something on the box that says, when do you test, right? When do you test if you're no symptoms or if you have symptoms? And if you are positive and negative, then what do you do? We need to make sure that that information is obtained. We knew that the test kits that were coming, when they came, had instructions in English and Spanish in terms of how to run the kit, how to do it, but we had to provide information on why to do it and what to do if your result is positive, what to redo if your result is negative. We talked about how to distribute. We didn't know when we were getting it. And then suddenly Thursday afternoon, this call was Wednesday at noon, Thursday afternoon at 2, out of the clear blue sky, we received these tests. They were
Who
delivered
from? Where'd they come from?
from the feds, HRSA. That's that's all the community health centers in the country report up through HRSA, which is a division of HHS, of Health and Human Services. But I'd been literally hounding them since October because they'd been talking about this for months.
Mm-hmm. And you got all the tests out. You got all the tests out.
So we saved a small number of them for this week because we knew we were not meeting the need of the people who came to our door to get tested. So we didn't. So last week we were turning people away and saying, sorry, we can't do anymore. This week we say, sorry, we can't do any more of the PCR test, but here's a rapid at-home test. Take it, go home, and here are the instructions. So we did save a small number for this week, but literally within Friday, Saturday, and Sunday, the vast majority of the tests were distributed within Fairhaven. Again, it's only 2,700 tests. You've read the numbers, what governor is trying to get like in the millions. It doesn't meet all the need, but it met some of the need. And I'm hoping, fingers crossed, I've put another order in, that we're going to get a similar number this week. No,
and you said, was it 24 hours or 3 days that you got all those?
Well,
out?
we got it on a Thursday at 2:00. Friday was a holiday. It was the New Year's Day holiday. We worked on Friday, but then we distributed them. So the Housing Authority for use in the housing units here in Fairhaven got some. The New Haven Legal Aid got some. Apostle Immigrant Services got some. Alder, she wasn't Alder until Sunday. Alder Miller got some, and she distributed them through her network and through some contacts, especially through the schools. Again, the Fairhaven schools. This all transpired. We got, a box to them, 2 boxes. Each box contained 90 tests, and they then distributed it to the people that they.
So we are running out of time. I'm sorry about that because we have to play the public service announcements to tell people to get vaccinated. Suzanne Lagarde, what a pleasure talking to you. Do you want to quickly say where we're going next with COVID and the Fairhaven Community Healthcare?
We will continue to be here for this community. This is what we are. We do our best. I wish we could get more help right now from the state. I want to get that word out. We need help in communities of color. I don't want to send my patients to the town green on a bus when I know there's a 45% positivity rate in this community. If these folks go on the bus, the positivity rate is going to be even higher. So I need help in this community, but we will be here. We will do our best, and we will do it in collaboration with our partners here in Fairhaven.
You've been doing it 50 years.
Yep. Not me. Not me, but Fairhaven. Yes, absolutely.
And I have this hunch it's going to be at least another 50 more. You can do a great job. Suzanne Lagarde, thank you so much for joining us on Dateline New Haven. And thanks for the work you do at the Fairhaven Community Healthcare, one of the beacons of light.
Thank you so much. Have a good new year. Bye-bye.
And thank you, Harry Drost, the WNHA station manager, holding down the fort through this tricky time of the resurgence of the Omicron variant of COVID. We're going to take it out with the Afro-Semitic Experience performing I Wish I Knew How It Would Feel to Be Free from the group CD, A Plea for Peace. This is Paul Bass inviting you to fly free with us all day, all night long at WNHH, New Haven's home for community radio.